Many people who test positive for COVID-19 survive. However, there could still be health difficulties that they face afterwards. Some could experience long-term health effects, but lingering issues can be severe in certain cases.
Nowhere near my normal self.
Michael Reagan was a healthy, athletic 50-year-old when he was struck with coronavirus back in March. The virus itself body-slammed him. He says he spent 2 months in and out of the hospital. But tonight, more than 4 months after he began to recover, Reagan tells CNN he still feels horrible, lingering effects like seizures, heart problems, nerve damage known as neuropathy, and even memory loss.
It wasn't until that, I was generally doing better that I started to notice a lot of the other symptoms. And I know other people must feel the same.
Indeed, experts say there could be hundreds of thousands of so-called long haulers like Reagan, experiencing medical problems they didn't have before getting COVID, problems which have lasted for months. And America's top voice on infectious disease now warns some COVID survivors could experience those problems for the rest of their lives. Dr. Anthony Fauci specifically cited the possibility of irregular heartbeats or the heart failing to pump enough blood to the rest of the body.
They could wind up, when you have inflammation, you could have scarring. That could lead to arrhythmias later on, or that could lead to cardiomyopathies.
Fauci also said it's possible some of those problems could clear up, but experts are worried tonight about other possible lifetime illnesses which could be sparked by COVID cases.
Not just in their heart, but in their lungs, in their brain, as well as in their heart and even other organs as well. And so those manifestations can be that of scarring. Once you have inflammation, you can get scarring.
Diana Barrett, another long hauler who's been recovered for more than 5 months, says she and her doctor believe her recent problems are directly related to her bout with coronavirus.
I have GI issues. I have deep inner ear pain, headaches. I was just diagnosed with, COVID onset glaucoma.
Experts say there is still so much they don't know about the long-term after effects of COVID, that the research is still inconclusive, but they keep discovering new offshoots.
We never necessarily expected we'd have skin manifestations and kidney manifestations and manifestations in the GI tract.
Doctors are also worried about the long-term mental health effects of the virus. One expert believes there's a clear link to depression.
It's very hard to know whether or not it is a side effect of the actual infection of getting the germ into the body itself, or it's because of all the wraparound problems that come with that COVID has wreaked, from family disruption to economic disruption.
Marine experts believe there are no more alive whales stuck on sandbars off Tasmania's west coast. Rescue teams have worked 5 days to save 180 long-finned pilot whales outside the heads of Macquarie Harbour. 108 whales have been successfully rescued, 20 of those yesterday and 15 the day before. The remaining deceased whales will be buried at sea by aquaculture companies. It is expected to take a number of days, depending on wind, tide and current conditions.